everyone. Today we're going to talk about lipomas. And lipomas in dogs are really common, especially as the dog ages. There's a genetic component. They're really common in lab. The other component is phlegm stasis. So it's a consolidation, it's a fatty tumor, and it's benign. So a lot of times the vets just kind of say, hey, it's benign, let's celebrate once they do their aspirate. But for us in holistic medicine, lipomas are not benign in the sense that they're not malignant, but they're not nothing. So there's two components to phlegm stasis. One is a blockage along the meridian, and two is the diet. So, you know, I always come back to this, but the diet and diet changes, especially a homemade diet, sometimes a raw diet, but can cure so many problems. And lipomas are one of those things, especially if the diet and the carbohydrates are contributing to the problem. So I want you guys to know that the first thing to do if you have a dog with lipomas, especially huge ones, you know, some of these labs, they can get huge, kind of almost basketball size or ball size lipomas, and they keep growing. And so they can impede how the dog moves and also just be a big kind of burden on the old dog's well-being. Lipomas are a big burden. So I want you guys to remember a diet change, come off that kibble and watch those treats. So we don't need any phlegm, okay? So what causes phlegm in dogs? Carbohydrates and sugars. Carbohydrates and sugars. Just tell all your friends, don't give your dogs carbohydrates and sugars. Sugars could be like dairy sugars. You know, I let my dog eat the ice cream. I share my pizza with my dog. By the way, why are you guys eating too much ice cream and pizza? That's another story. But anyway, let's look at where these lipomas often form. And I mentioned these are older dogs. So the gallbladder meridian, I write about this in my first book, which was called The Last Chance Dog. The gallbladder meridian is the most common place where we're going to find lipomas. And that's this meridian right here. These charts came from a book called 4 Paws, 5 Directions, Cheryl Schwartz, one of our wonderful holistic vets. And so a lot of times what happens is, in addition to the dietary causes, we have stagnation in certain places. Why? Because we have injuries to our knee, injuries to our hip or hip arthritis. We have injuries to our shoulder. And see how the gallbladder meridian involves all of those places. So look at where these meridians are. These lipomas, they grow on the side where there's the most stagnation. So if it's the right side, there's probably been a right-sided trauma. If there's a left-sided lipoma, there's been a left-sided trauma. So oftentimes these older dogs have a history of being fed kibble and a trauma to the same side. We can also see lipomas in other places. On the conception meridian, that's where we've often had surgical scars that block that meridian. And sometimes on the urinary bladder. And these lipomas that form here are often from chiropractic problems. You'll see the body even putting fat and adhesions and scar tissue in a way of trying to stabilize the spine. You'll see lipomas in multiple meridians, but those are the main ones. The other cause that I didn't talk about yet for lipomas is endocrine imbalance. So it's very common for a cushingoid dog or a hypothyroid dog to gather fat in certain locations. Again, it won't be an accident where the fat is gathered. There will be reasons for it. A lot of hypothyroid dogs gather lipomas along the large intestine, along the heart meridian, along the stomach meridian. And a lot of times these lipomas that form in these areas are the ones that need to be often are surgical removed because they block the movement of the front leg. So Phineas is here for lipomas. You can see them up on his back. You can also see him on his side. He's actually quite a healthy dog, but labs are known to have lipomas. And genetically, they tend to stagnate phlegm. In holistic medicine, we think lipomas are more important than in Western medicine. In Western medicine, they basically ignore them unless they take them out surgically. When they take them out surgically, they tend to grow back. Right, Phineas? He's ignoring me. That's fine. Let me see if I can get a little close up on that lipoma. You guys can see that it's hard to show it with the dog, this color, but it's a pretty good sized lipoma. Yeah, that's good. Yeah, right, that whole thing. And he had one removed from the other side, and he also has them in front. And then he also has these lipomas. So in holistic medicine, we actually really take big action with lipomas. We do not ignore them. We basically say, let's use herbs and diet to reduce the amount of carbohydrates in the diet. We also want to reduce anything that contributes to phlegm in this dog. So it could be food allergies, it could be dairy products, it could be carbohydrate sources, it could be fatty type foods. And now he's on a homemade turkey recipe. And let's see, what else do we want to say about lipomas? Anything you want to add, okay?
There's small ones under his armpit.
Hey everyone, thanks so much for joining me for this video on lipomas, and I hope you learned a lot and you can share it with your friends. Lipomas are super, super common. Again, they're not a benign lesion. There's something you need to take action on, and it doesn't have to mean that you need to do surgery. A lot of times lipomas grow back once you do surgery because the initial cause was never addressed. So I want you guys to take action yourselves, change the diet, and get some acupuncture to help with those blockages. And thanks so much. Please share, subscribe, and help us out by just hitting that subscribe button. Thanks so much.